My name is Dr. Nita Jane Carrington, and we're doing a second National Nursing Research Webinar of the Beta Nu Delta Nursing Society, which envisions the latest updates of emerging topics in nursing and healthcare from our leading doctoral nursing researchers in the Philippines. So I am assuming that most of you, my audience today, are doctoral nursing researchers, who many of you may become educators for our next generation nursing graduates. So to fulfill the theme of this webinar, Knowledge Development in Nursing for a Better Health, Better Philippines, I chose the three following topics to present. Number one, concept-based teaching for students, conceptual learning. This is an emerging topic because I don't think many of our nursing schools are yet teaching this way. The second is leadership. This is really not an emerging topic, but nurses are now expected to perform many roles, and that nurse educators should be leaders, or all nurses should be leaders in our field. The third one is self-care. It's as old as life itself, but our society has many health problems because of the lack of self-care. So to start, concept-based teaching, which is my first topic. In concept-based teaching, students must learn how they know, not what they know. A step towards achieving this is to know what concept is. So what is concept? They are abstract ideas, general notions. Examples are values, beliefs, truths, thoughts, actually your name too. Things that are not visible, things that you cannot touch. There are four main topics in nursing that a nursing student needs to be familiar with before a student can begin to care for patients. The four concepts are the human being, which is the patient as a whole, the environment, health, and nursing. I don't think I need to elaborate on this, as I'm sure we are very familiar with how these concepts are applied. To accomplish conceptual teaching for our students, we need to teach concept mapping. Concept maps are visual representations of information. They can take the form of charts, tables, and flowcharts. These are especially useful for students who are visual learners. Concept mapping is an instructional strategy that requires learners to identify graphically to link key concepts by organizing and analyzing information. And these are samples here. These are good examples of how concept maps are organized. This third one did not come out very well, but you can see that it has a nice flow to show mapping concepts. The second one actually is what I usually use in classroom and clinical. So now that we have looked at concept maps, how do we deliver concept-based teaching? I have identified four pillars of clinical practice, because this is where our nursing students end up after nursing school. The first one is evidence-based practice. Evidence-based is the professional inquiry and research of best practices. I would like to emphasize that, best practices that have been tested and validated. We usually require our students to do research in the early years of nursing school. The second one is critical thinking. How do we teach critical thinking? We guide our students in the process of actively evaluating information. Actively. What are this information? They are research data that have been tested and proven. I want to emphasize that again. Research data that have been tested and proven. For example, why do we bathe our patients? Why do we get them out of bed early after surgery? Oh, I'm sure you know the answers to these, because these are simple nursing interventions, but their efficacy and positive effects towards faster recovery of patients have been proven to be evidence-based. So we guide our students in analyzing and applying this information. We actively involve our students throughout their nursing school. I attended a webinar on innovating an ancient technique to teach thinking. It was about engaging our students in storytelling, and actively participating in discussions, both in classroom and clinical, using real case studies. The third is clinical judgment. Clinical judgment requires practice in realistic learning environments. Thus, our clinical rotations, so students observe and practice with real patients. This may be somewhat hampered now because of the coronavirus pandemic. Simulation in the lab is next best, but the experience is not optimal, in my opinion. Clinical judgment is making decisions based on critical reasoning, learned information, and lived experiences, again attained during clinical rotations and taking care of real patients. Clinical judgment requires the formation of habits. I want to emphasize that again, formation of habits during experiential clinical rotations. So other authors stop at clinical judgment, that's the third one. But I have added a fourth pillar that is most important to me, and that is clinical competence. And I even put it in red because it is the doing part of critical thinking and decision making, because it measures the delivery of patient care, and it is also the observed outcome of critical thinking, decision making, and clinical judgment. It's the ultimate yardstick if patient care has been effective. Did the patient get well? Because safety in patient care is bottom line. So please give your students the tools they need to build habits of evidence-based practice, critical thinking, clinical judgment, and clinical competence in their future practice as professional nursing. My second topic is leadership. According to John Boggs, effective leaders aren't born. They grow by choosing to think and act a certain way. Leadership is power to influence others, I hope in a positive way. Leadership is inspiring everyone around you to live a better life. Just being yourself, true self, or your authentic self. I submit that all nurses are leaders because great nurse leaders inspire and guide great nursing practice. During the current coronavirus pandemic, nurses juggle many roles within the healthcare system. They are on the front lines caring for ill patients. Nurses balance to meet the demands of patients of doing the job well, but which requires knowledge, physical skills, the cognitive ability to manage time, and also educate the patient. And best of all, it is the caring attitude that is the hallmark of nursing care. Other demands of nurse leaders in a growing and rapidly changing profession is, or are rather, educators, mentors, preceptors, advocates, researchers, financial consultants, data analysts, case managers, and through other formal or informal roles. The American Nurses Association has declared that all nurses are leaders because all nurses are expected to demonstrate leadership and must challenge themselves and the profession to develop effective leadership. So I have adapted Dr. Kimberly Gibbons' 5 leadership styles in nursing. The first one is transformational, democratic, autocratic, laissez-faire, and servant. I'm going to describe this, but as I go over these leadership styles, perhaps some of you will identify which style you most identify with. So transformational leadership. It is collaborative, encouraging, and inspiring a shared vision to facilitate change. A transformational leader encourages innovation and is tolerant of error. In healthcare, transformational leaders are most successful in situations where the system is in need of larger changes or overall improvements. For example, a policy change on how often should a critical care patient be wakened up during the sleeping hours. Some patients experience neurosis if unable to get adequate sleep while in the intensive care unit. The second is democratic leadership. A democratic leader engages in shared participation of members of the group to guide decision-making and management. Sometimes this is called participative leadership. Democratic leaders are often characterized as mutually respectful, collaborative, empowering, and supportive, but when a system or process improvement is imperative, may step into a group assigned to identify changes to a policy or protocol. Autocratic leadership is the third. Autocratic leadership is a unilateral style in which the leader delegates to others with rules and orders. These leaders are intolerant of innovation and error and are the opposite of laissez-faire leaders. An autocratic leader or autocratic leaders are generally characterized as self-reliant, highly structured, rapid decision makers, authoritative, and ultimately the boss. This leadership style may be useful in healthcare during emergency situations, traumas, or disaster management when clear, definitive, rapid decisions and directions benefit all involved. So as a critical care nurse for 50 plus years, both at the bedside and teaching senior graduating students, and have been in administrative positions, I have experienced this leadership style, which is called for often. The fourth one is laissez-faire leadership. A laissez-faire leadership style is a facilitated one in which a leader makes few decisions, often identified with a hands-off approach, facilitates the group to develop solutions, which is this laissez-faire is an opposite of autocratic leadership. The fifth one and last one is servant leadership. Finally, servant leadership is defined as a supportive style in which the leader provides team members with skills, tools, and relationships they need to perform to the best of their ability. Servant leaders are often noted to share power, listen actively, conceptualize problems, empathize with others, and prioritize others over themselves, which is not really a bad style of leadership. So I have occupied leadership positions throughout my professional years, and to be honest, I have exercised all 5 of these leadership styles. You may have also. So my third topic is self-care. In my Master of Science in Nursing program, I was exposed to all nursing theorists, and each of us graduate students had to write our thesis from the theorist we identified with, from how I was raised by my parents to when I raised my own children, my own personal practice of health, and my practice of nurse practitioner. I identified the most with Dorothea Orem on her theory of self-care. I'm going to give you a couple of seconds here to look over the nursing theorists and see whether you would identify with one of them. So to move on, my viewpoint on 3 aspects of nursing and health education are, the first one is incorporate self-care. I really like that in all undergraduate nursing and health sciences courses. The second one is self-care education for patients as a professional commitment in all of nursing practice. I like that too, because all nurses should be committed professionally for self-care. The third one is nurses and health educators as vehicles in educating and empowering society in self-care. Nurses should really be vehicles. In other words, we can educate and empower our society, our people, so that they can care for themselves. So I would like to challenge you this question. Should the framework of self-care be a major movement in nursing education? My view of the human being is his or her capacity to think, choose, and self-actualize. My philosophy of life is in relation to one's responsibility for health. And really, I'd like to emphasize one's responsibility. So with these values, you know what? I think I missed a slide here, so I'd like to go back there. It is the nursing education as vehicle to educate and empower others in self-care. Because self-care is key to our health and well-being, our family, our relationships, and the state of affairs, and the state of our society. I believe that nurses are professionally charged as educators for health. What better place to start than our nursing and health sciences program? What better place to be recognized as leader, my previous topic, in the movement for a healthier society? Because bottom line, safe patient care starts with self-care. Okay, back to my challenge question. Should framework of self-care be a major movement in nursing education? Again, I'm going to repeat myself. Sorry about that. My view of the human being is his or her capacity to think, choose, and self-actualize. And my philosophy of life is in relation to one's responsibility for health. And I really would like to emphasize one's responsibility for health. So with these values and beliefs, I will close my presentation. So as your keynote speaker for this webinar, I hope I was able to contribute to the knowledge development in nursing for a better health, better Philippines, specifically in the Philippines. So thank you for giving me the opportunity to share my passion for nursing education in the Philippines for better health through self-care. Sorry, my PowerPoint seems to be a little lagging. But anyway, thank you again for giving me the opportunity as your keynote speaker to share my passion for nursing education, leadership, and the principles of health through self-care. And I hope that I was able to contribute to the knowledge development in nursing for a better health, better Philippines, specifically in the Philippines.